Hello, my name is Dr. Sam Kazia. We are very lucky here at Cardiovascular Consultants as we have multiple interventionists, including Dr. Ramanini, Dr. Schreiber, myself, who are specialized in vascular intervention. So in essence, a patient who have been diagnosed with peripheral arterial disease is at higher risk of having actually a heart attack within the next 5 years. That's why it is important that we are able to detect such disease in patients who would be at high risk for vascular and coronary arterial disease. Those patients usually are smokers, or patients who have had history of diabetes, or a patient who has had history of coronary artery disease, bypass surgery, or angioplasty and stenting. Not every blockage needs to undergo angioplasty or stenting or even surgical intervention. In fact, most peripheral arterial disease situations are managed medically. The management of heart disease is exactly the same for management for peripheral arterial disease. It is the same disease, it's just a different location. So it is essential that cholesterol medication is an integral component of your therapy. It is advisable that the patient be on aspirin. There are other medications your physician will talk to you about, which might be also important for you to take in order to improve the blood flow into your legs, decrease the chances of having a clot forming over the blockage. Now, if the patient, despite medical therapy, continue to have what we call lifestyle limiting claudication, meaningly it's affecting your ability to do your regular activity in the mall, at home, or if you are a golfer, or if you are a person who enjoys regular walking and you cannot do that as often as you did, then we need to go to the next step by evaluating the vascular disease with an angiogram. If the patient has advanced peripheral arterial disease, which will include not only claudication or pain, but having pain at rest, this is an urgent situation. This patient needs to be looked at as soon as possible. Dr. Ramanini, would you please help us understand how would you go in determining whether a patient who has a blockage, once you have looked at it by angiogram, whether this is needed to undergo intervention, and that intervention would be with angioplasty or stenting or not?
Once such a determination is done, it provides us with a roadmap which gives us a very clear idea of where the blockage is located, how long the blockage is, and how tight the blockage is. Majority of times, we could be able to take care of this with multiple devices we have. A plain old balloon angioplasty means just taking a balloon across the blockage and opening it up. Sometimes we might need to use a stent device, which is a metal reinforcement to keep these blockages from falling back into the way of blood flow.
It is important for you to understand that medical therapy is the cornerstone for peripheral arterial disease, and you need to have repeated testing to evaluate the peripheral arterial disease. And also remember, if you have it in your legs, there's a higher potential you have it in your heart, or in your carotids, or even in the arteries in your brain. And our cardiologists at Cardiovascular Consultants are keen in making sure that your cardiovascular evaluation is complete, is based on scientific evidence and guidelines, and appropriately done in a timely fashion. I hope that this session has given you a glimpse of what is peripheral arterial disease and what can we do about it here at Cardiovascular Consultants.